beards are like our version of makeup to hide imperfections. I don't use makeup, but I have a beard to cover half my face.
I actually had submental lipo. He did it here, and I love it. He took out 100 cc's of fat. Where was that even sitting? Like,
you're going to see a little bit of difference overall. It works, but does it work enough for the price point?
I talked to the patient. I said, look, I don't feel comfortable doing your surgery right now. I'm like, I haven't slept in 2 days.
I had a breast cancer case yesterday, bilateral mastectomy, reconstruction with tissue expanders. And then the nurse calls me at like, it was like 9:15 or something. She's like, it seems a little bit more swollen on one side. I'm not like 100% sure. Thought, we should let you know. And I was like, there's no question I'm going to ask that's going to stop me from going in. So I'm just going. So I get in there, and it was probably 15 minutes, 20 minutes later. I'm pretty close to the hospital. I get there, and the nurse walks into the room with me, and she's like, wow, it is way bigger than when I just saw her 20 minutes ago. So she had, bruising and a bunch of volume sitting on the top end of things. Clearly, blood collection, hematoma. So we took her to the operating room. And I think that it's kind of funny for people who think about emergency situations, right? It's like if you watch Scrubs or Grey's Anatomy, people have this idea. They're like, it's an emergency. Just like grab the bed and push them into the operating room where there's like a waiting team that everybody's like there ready to rock. But even in the best of circumstances, it's like a half an hour. And I got lucky. It was a half an hour, but that's because they have to open the room and open up all of the instruments and make sure that everything is sterile. The anesthesiologist is at home and has to come in. We have to do all the paperwork. It's interesting because I don't think people realize, even in the most urgent of situations, nothing happens like that fast in an operating setting. Yeah. But thankfully, we were able to wash everything out. There was one bleeder, and interestingly enough, we actually found one. Half the time, I feel like when you go in there, it's already stopped. But found the bleeder, zapped it, washed everything out, closed it all up. She was doing great today, so that was excellent. But that was my 9:15 to 12:30 last night. So super exhausted. It was a long clinic today.
Well, here's the thing. I thought about this a lot, like as a resident, right? Because as a resident, we think, we work, 80 hours a week, right? Really, we work way more than that, but documented 80 hours a week. And I remember, in training, you think, man, this is a lot of hours, and your family is like, where are you? But as an attending, once you get into private practice or into the real world, like you're the one responsible for all your patients all the time. And you can be in a group and maybe all cover each other, like if you're out of town, but in reality, like all that's on you. Like you don't have another person be like, hey, can you take care of that for me? I need to sleep. I got to get up early the next morning and do more surgery, right? It's all you. And you realize like a lot of that residency training was really just prepping you for like real life as a surgeon and as a doctor. And there's been times when I came back here to Utah and I was doing trauma hand call. And I remember there was a time I had been awake for over 48 hours straight. I was on call that night, and I'm sure you've had this too. Mm-hmm. And it gets to the point, like for me, I remember that day I had a case I had to add on. A patient had fallen like 30 feet, had broken both arms, both legs, and needed to do, it wasn't an emergency surgery, but needed some, external fixation. And I remember I walked into the room, I talked to the patient, I said, look, I don't feel comfortable doing your surgery right now. I'm like, I haven't slept in 2 days. And I said, I think we're going to have to wait. And he's like, thank you for telling me that. He's like, I'm totally fine with that. Let's do it. Come back and circle around, do it tomorrow. And we did, and it was fine. But I think we also have to know our boundaries. We're definitely not superhumans. We definitely train to stand for long periods of time in one location without going to the bathroom. You like you said, you went last night at midnight, and you got little kids and your family, but you still got to take care of your patients. So I think I really look back at residency, as much as I didn't love it at the time, like I really think it conditioned me to be able to deal with these situations.
Yeah. We think during residency, it feels very, very difficult. And I think that it seems like it's going to be easier on the far end because you're not at someone else's beck and call to work as long as you have to. But I think that as a resident, I truly underestimated the weight of having patient care and you being like the end all of like how all that works out and how that patient is going to do, the weight of needing to do the best thing for that patient versus as a resident, you're like, okay, I'm told to do this thing. I will do this thing. But in honesty, this the attending who's carrying that weight to make sure that patient's, getting the care that they deserve. And it's a real thing. I definitely underestimated that. But I feel that weight to make sure that people get, the care that they deserve, the results that they're after. But it's something more difficult than I was imagining it would be coming out of residency.
I got a question for you, Sean. Now we've been doing this for a few months. What are your thoughts on at some point bringing on a guest? I know we've talked about this before, but you've mentioned some people. But at one point, do you think we should be like, hey, let's bring on somebody?
Yeah,
and what do we talk about?
Yeah. Well, I think that bringing people on to discuss things that you and I don't have expertise in. I mean, obviously there's a lot of things we cover, but we don't cover everything between the two of us. I think that bringing people on who have special information or things they can share with the viewers and listeners out there, I think it would be excellent. I mean, I'd be up for that at any time.
Cool. I think it'd be good. Maybe we do like some kind of social media questionnaire or maybe on our page, just asking people like, hey, are there certain topics that you guys want to talk about? And then maybe we can think of our colleagues or friends who have experienced those areas and, maybe pick their brains on some things and learn from them. And I don't know. I think there's a lot of opportunity there.
Yeah, absolutely. I mean, it's like you and I don't do rhinoplasties. It's like I do some facelifts, but not super high volume. But you and I tend more towards breast and body. So I think it would certainly make sense to bring people on if we're talking about those types of topics, especially if there's kind of things that come up for it.
Yeah, definitely.
Yeah, absolutely. But that actually does bring something up. So big news for us, the website is live. It's been a long time coming, settled in and running. So if people are interested, go on. You can see full episodes on there, read about the two of us and kind of how we train and where we come from. And then there's merch. So if you're looking for t-shirts, stickers, hoodies,
What's the web address? Can you tell everybody?
Yeah, so it's going to be plasticsurgeryaccutabove.com. I mean, if you had to guess, you would probably see it.
All right, I'm going to pull it up right now. We can look.
You're like, watch, it's down.
I spelled surgery wrong. I spelled surgery. Here we go. That's working.
The surgeon spelled surgery wrong.
Let's go.
Look at it. It's beautiful. It's beautiful. Love that.
All
Professional.
There. Yeah. Podcast. Where's the merch section, bro?
If you go through the menu, it has a little shop.
So the merch is down there.
I'm proud.
I need to rock one of these, dude.
Yeah, I actually want to get one. I love that it zips and like physically separates us.
That's cool. All right, I'm going to get one. And there's t-shirts. You kind of look like John Wick in this, dude. Cool.
It's when my hair was a little bit longer. I got to get the hair back to match it.
Oh, a sticker? That's nice. That's sick, dude. All right, look at that. Yeah, that's great, dude. All right, I'm going to get me a John Wick plastic sticker. No, I'm just kidding. It's a good look.
I mean, it's not a comparison that I would avoid if people were to call me the John Wick of plastic surgery. I'd take that.
Actually, I watched this Instagram today about John Wick. So it's 10 years since the first John Wick came out.
Oh my God.
2004,
we're old.
Right? Yeah. Now we're up to 4 and they're working on 5. But it was really cool to hear the story behind, how it was a very low budget film, how they raised the money, even Keanu Reeves himself and a lot of the actors in the movie putting their own, capital into this to get this thing off the ground. Mm-hmm. And of all people, Eva Longoria was the kind of final person that helped it. She put in like maybe $6 million. The movie did so well. She's like, that's the best return she's ever had on anything. But
that's
it was
a good investment.
Risk.
Yeah.
But it was cool to hear it because it made me think of like what we do on a small scale in our practices, and I was talking to a friend today at lunch about this in a business meeting I had. And it's like as surgeons, like I think if we're in private practice, one thing we think about is like taking a risk on yourself, and I feel like I had to do that. You've had to do that in what you do. And just kind of investing in yourself, and instead of investing in other companies and things, like taking that capital and putting yourself and hoping growing your business, So maybe think John Wick.
Yeah. It's very interesting. And you hear this every once in a while for Hollywood, where you think that famous actors and actresses would get what they want from studios. They're like, I want to produce this movie. I want to be in it. I want to star it. I'll put up some money. And then even they have trouble getting things moving sometimes. And you think they would have all the pull in the world, but having to kick in their own money for it. I think that happened with Deadpool too, didn't it?
Oh, with Ryan Reynolds, probably.
Yeah.
Yeah, totally.
Yeah, I heard that it was like his baby for that. But it's so interesting that these ones that are getting pushed by the actors or actresses themselves end up being like fantastic. People are very excited about them. And I guess it's because they're excited about the project themselves.
Yeah, I think when they're obviously invested in it financially, but also like emotionally and everything, they put everything into it. Yeah, for sure. I think it comes through on the screen. And I see that like in what we do. Again, if you want to parallel that, I think, these people see our passion in what we do because we really are all in, like we're invested all in. And this is like our livelihood, but we get a chance to share, what we've learned and help other people and patients. I think it's a awesome opportunity for us.
Yeah. Well, in that parallel, which one of us is Keanu Reeves and which one of us is Ellen Korea?
If we're going based off looks, it's not me for either.
I get to be both.
I'm the big Asian dude that gets destroyed in the first scene of part 2.
So let's jump to first topic I had here. Where are these down? Oh, so if I'm scratching my back while we're going, I had another round of tattoo removal on my upper back on Friday. And I'm in the itchy stage.
You're like,
it's a real stage. Yeah. And you can imagine operating, right? You have had laser tattoo removal and it's only painful for the first day. That goes away pretty quickly, but the itchy is so much more itchy than getting a tattoo, which has its own itchiness thing going on, but it's like super severe for like 2 weeks. And I never really considered it as a surgeon, right? Sterile gloves on. What am I supposed to do? I got to rub up against a wall to scratch my back.
Like a sandpaper behind your back. Yeah.
Yeah. Or I have to have a circulator to scratch my back or something. And you're like, well, I can't scratch my own back. Now I have to figure out something how to deal with that. But I can look forward to another 6 to 10 sessions of that to get that taken care of. Wow. I don't regret many tattoos that I have, but the first one I got was massive and so bad. It's terrible. It has to go. And I never really thought about getting rid of it until I was talking to one of the cosmetic tattoo artists groups that we work with. And they're like, well, we have a Pico way we can take it off. I was like, that's actually great. I would love to do that. But yeah, it's definitely a thing. I'm very much looking forward to having it gone so I can get something much better and glorious in its place. That should be interesting. But yeah, it's an eagle, but it's supposed to be a bald eagle, but it looks like a turkey vulture because the eyes are wrong. It's instead of having the hooding over the eye, it's like a circular eye. So it definitely looks like a turkey vulture. So bad.
Couldn't you just add a little bit of hooding?
I had someone touch it up to try to see if it could really dial it in. It's just. It's not enough. So it's got to go away. So if you see me scratch my back, that's what I'm up to. I'm not just being weird. All right. So
good disclaimer.
So one of the things I wanted to talk about, and I don't know if I'm just being targeted on my Instagram ads and maybe I'm living a life that nobody else is currently experiencing, but I feel like I see a zillion ads for at-home red light therapy masks. Are you also on that train as a 40-something-year-old male, or is it literally just me?
I see them a lot. Probably not as much as you. Maybe it's you're up in the Pacific Northwest. I think you need it. I have no idea.
There's no sun damage up here. We don't have sun. I don't know why I would need red light therapy for it.
That's true. I don't know, dude. I don't see that as much, but I definitely, you hear a lot of people talking about it. I think on TikTok I see it, not ads, but people talk about it.
Yeah.
But what are your thoughts on it? Because you hear about it and the potential benefits.
And I feel like you see so many things that they put on there that it's you can put it on your back for back pain. You can use it for discoloration. You can use it for hyperpigmentation. You can use it for collagen production. And you see there's so many different masks nowadays that you see lists on like Esquire, top 20 red light therapy masks. I'm like, why are there hundreds of them that we need to make lists to figure out what the top 10 are? It's like, why are there not very specific like winners?
3, yeah.
Yeah. I feel like Omnilux is the one that I see probably the most as far as ads are concerned. But I feel like the more I dive into it, you start to figure out like, well, what's the best one? Because my wife asked me about it. She was like, hey, I'm interested in getting it. Are one of these $100 ones worth it? Or do you have to buy something that's, $3,500 to actually work? Because they have medical grade ones that we can purchase for, our businesses that run into the thousands to tens of thousands of dollars. But I feel like the harder I look into data and what actually seems to work, the less convinced I am that this $100 or $500 thing that I'm going to purchase is really going to make a significant difference, other than forcing me to take downtime and just chill out, because I can't imagine you can do anything with the red light therapy mask on. It's like maybe you have a creepy. Yeah. Well, I think maybe it's like meditating or something where you're forced to not interact with folks, so you just feel better about things in general because you took 20 minutes off a day just to not do anything. But I haven't been strongly convinced that there's anything that we can buy personally that's relatively inexpensive at the home that's really going to work.
I think we see that in a lot of areas of aesthetics anyway, right? I mean, there's a lot of at home, like people are trying to do all these other things to microneedle themselves, for example, right? Mm-hmm. Like to try to create this crossover from the medical side, medical grade of even skincare and all these things that on the medical side that actually have been shown to work. They try to, I think, cross over into the consumer side. And then you have things like Amazon where people literally just proliferate the same device just with different brand names, essentially, because they're all being produced overseas. And they can just copy and paste that and put a different brand name. So now everybody's selling, the same mask, just the different brand. So the reality is, it's probably all the same. But you're right. I think it's, as consumers, we just see ads and we see it on social media, but there's actually benefit to it all, right? Like you're saying. And I think it's super gray when it comes to the consumer side of it, because there's just no backing for any of that. And it's dumbed down versions. There's even like chemical peels and stuff that people try to do on their own at home. I mean, they're not medical grade, or they're super low concentration of certain products. You're just not going to get the results that you think you might get if you're compared to medical grade skincare.
Yeah, no, I definitely think that's true. And when you look at the data for lasers, peels, microneedling, it's like the data is there, but the second that you make it safe enough and comfortable enough and cheap enough to get it directly to a consumer, the likelihood that is going to be effective, and certainly not as effective as the original version, the chance that it's going to be effective seems pretty slim.
Yeah, totally agree.
Like nobody's doing a 40% TCA peel at home, just swiping on. That's gonna burn. It's like you tolerate 10. It's like it'll make a difference, but how much of a difference? I think that's the big thing.
Yep. Exactly.
So no red light therapy mask for me, I guess for now. Maybe a good one will come out with data.
Next episode, we should both be wearing one.
Oh, yeah, Omnilux for both of us. We can
maybe they'll sponsor this podcast.
I will. If you send it to me in the mail, I will wear it for an episode. How's that sound?
Yeah. All right, it's on.
And so I was reading an article in Glamour.
Sounds right.
That sounds like a normal thing that a 43-year-old male would be doing. I'm definitely the prime demographic for Glamour, but I was reading an article in Glamour, and I want to make sure that I get her name right. Malia Griggs, who wrote this article just talking about her experience of having chin liposuction, which I'm not a fan when people call it chin liposuction, because we're never liposucking the chin. It's always the submentum or the neck. But she had hereditary double chin that she wanted to touch up, and she was in her mid-30s. I think she was 34. But she was just talking about her research on what was going to be effective for her to get her the result that she's after. And we always talk about this balance of like non-invasive, minimally invasive, true excisional procedures, and what within that realm is going to be effective for you. So the two things that she talked about before she decided to get liposuction, and I'd like to have your opinion on these two, is the first one was Kybella. What are your thoughts about Kybella? Do you offer Kybella within your spa, or you don't carry it?
We do carry it in our spa. And so for people that don't know what Kybella is, essentially it's a injectable product that goes in and just like lyses the fat cells, the adipocytes, right? So that is meant to break down the fat, but that only addresses the fat. And the neck swells like crazy. It almost looks like they had like a full-on, liposuction neck lift event. It just gets super swollen and bruised, and it stays that way for a while, a lot of edema. So we offer it, but honestly, like our nurse injectors don't really do it, because I really think the indications for it are very minimal in people that are actually good candidates for it, right? So essentially they need to have minimal excess skin and, like I said, maybe some form of secondary or hereditary fat pad. But again, there could be an imbalance of skin and fat. So I think if used improperly, it could give you not desired results. No. So we really don't use it. How about you guys? Do you utilize it at all?
I don't utilize it at all. And I feel like when you have access to liposuction, it's like if I have fat that I want to get rid of, I'd rather just do lipo. And it's because I don't have an attached med spa where I need options that non-surgical providers can utilize. One thing I didn't know about it is that it is a bile acid. That was a new one to me. I didn't know it was a secondary bile acid. I assumed it was like some form of, saponification soap agent. And that's the way bile acids are. They work to solubilize fat so your body can break it down more efficiently. But it is actually a natural product of our bile. Obviously not from a human. It's made in a lab. Clearly, they're not.
It's a deoxycholic acid.
Yeah. But it's actually a secondary bile acid. So it is like a naturally occurring product that they're using. Just it's utilized in your GI tract to break up fat. But that was a new one for me. But it's not something I use. So that was number one. The other was cool sculpting. Y'all do cool sculpting? Because I know that they're coming out with a new one, right? It's like Cool Sculpting Advanced or whatever the second generation one. I just started seeing, ads and marketing for that.
Yeah, I think we don't offer cool sculpting. But one thing I think, if you look at the company, AbbVie or Allergan that owns both these products, actually, they do so much market research and background research before either acquiring or doing the R&D on these devices to see if they actually work. So obviously there is some level that it's working, right? But when it comes down to it for us, I think the reason why we haven't done cool sculpting is because literally everyone up and down the street offers it, whether they're a plastic surgeon, a med spa, a family practice office. I mean, it's pretty much open to any type of practitioner offering it. So, at some point there was this super saturation in my area of cool sculpting. And so to get a device that costs, the price of a really nice car to generate revenue, that's one thing. But if you really can't utilize it because, it's just not there, it's hard for us to do it as a practice, And so we've never invested in that. But I know practices that do very well with it and really like it. I don't know if maybe you can speak to this, new devices have the issues with the PI or P, was it PIH? Or PAH.
PAH,
yeah, PAH.
Paradoxical adipose hypertrophy.
Yeah, so essentially the fat grows in size instead of doing the shrinking in size. It does the opposite. It somehow triggers the fat cells to do the opposite. So people that have the device placed can actually see an increase in their fat, which is what you don't want. And the fat actually feels very fibrous. I don't know if you've ever had to liposuction that or correct that. I've had to do a few actually. have to use ultrasound to break it up. It's really, really tough fibrous fat.
Yeah.
But what do you
actually saw a patient? Yeah, it's not something we carry. I remember when the device kind of first came out, we were in residency, and I remember the rep came to talk to us because we're in Orange County, and this is where it's going to sell, clearly. And I remember they showed the graph of looking at people's waist circumference before and after doing, it was a couple of rounds of cool sculpting, and they were doing 360 with it. And they looked at this bar graph that shows that how like such a dramatic difference. And when you looked at the y-axis, you found out that people was seeing like a centimeter to 2 centimeter decrease in their entire circumference when they did circumferential cool sculpting, which is expensive. That's not inexpensive by any stretch of the imagination. Several treatments for that. So the rep was saying like, oh, people will feel the difference in their pants. And you're like, sure. I mean, you're going to feel a little bit of difference in your pants at 1 to 2 centimeters. You're going to see a little bit of difference overall. It works, but does it work enough for the price point?
Yeah. I think the sell on it is right. It's like, oh, well, it's non-surgical, so you're going to come, but you're going to spend a lot of time sitting there having the treatments done. And yeah, you're not asleep, but like I mentioned earlier, I think us as surgeons, we're like, what are all the tools we can offer a patient that's going to be probably the most time efficient, the most cost efficient for them, and get them the result they want. And for many patients, what they're wanting doesn't match up with what you're going to get with certain tools. So that's why I think, being able to offer liposuction, say, hey, you get pretty much one surgery, you're going to see several inches come off, not centimeters, inches. And, I personally have had it done. I mean, we've talked about this. I'm almost 3 months out. I love my results that my Dr. Garlick, my partner, did for me. I actually had submental lipo. He did it here, and I love it. He took out 100 cc's of fat in my neck. I'm like, where was that even sitting? Like, how? But I love my, yeah. I mean, he definitely got it, and everything looks really good. So yeah, I think being able to offer all those things is super important for patients, because I worry that for some people, they go in thinking that a device like cool sculpting or even microneedling is going to give them a liposuction result. It's just not going to.
Yeah. And I saw my first patient with PAH probably 3 months ago. And she had it because someone she knew got the machine and they needed trial patients. She was not concerned about how her abdomen looks. She was just like a test subject for them to like test out the machine.
Like, sure, why not?
And it was wild. It's like, I was not prepared for how significant the change was just in her lower abdomen. It's a section this big.
Right where the applicator was.
Yeah, that looks like literally several hundred cc's of collected fat, which is completely and totally disproportionate to her entire body, because she was pretty thin overall. She was like early 60s, if I remember correctly, but just this pouch of the lower abdomen that she did not have prior to it. And it's so desperately sad for her that she ended up with that. And I don't know what treatment that exists within plastic surgery that one of the side effects is the exact opposite of what you wanted. Right? It's like you don't get a breast augmentation and your breasts come out smaller. Like, when has that ever happened? It's like, I didn't know that was ever a thing, but it is mind blowing to me. And I know that it's rare, right? It doesn't happen all the time, but it's significant enough. I'm like, why would we do that? I would stay away from that. Maybe they fix it with a new machine. I'm not sure, but going back to take care of that will certainly help her out. But yeah, I was shocked at how significant it was.
Yeah, I've had a couple of patients, and one patient actually, he is, he cuts a lot, and, for his competitions, the thing he body builds, and the guy will get down to like less than 7% body fat, like right around 7% body fat, but had a treatment in his lower abdomen, and same thing, like you said, like this guy is super lean, and then just boom, this like football of fat just right up below. It looks so abnormal. Yeah. And
it's so localized.
You're going to feel self-conscious of that because it just does not match your body. It's obvious that something's off. It's worse than, had he never done anything like you mentioned with your patient. So, it's something, I think everything we do in plastic surgery, it's knowing the potential risk benefits. But a lot of times, we hear risks like, it's not going to happen to me, right? It's like, oh, sure. It's like, even if it's less than 1%. But guess what? If it happens to you, it's 100%, right? It doesn't matter if we say it's at 1%. If it happens to you, it's 100% that it happened.
Yeah. So you're not going to be like, you know what? Well, it doesn't happen to most people, so it's fine. It's like, you're not going to feel good about that.
Yeah.
Well, good thing for Malia, she didn't get cool sculpting on her neck, and she didn't have Kybella. She ended up getting liposuction, which is great. Perfect. And the thing that I first thought is, if she's in her mid-30s, she needs something else, right? It's like, it's not going to be just lipo unless you have really good skin. It's like, for me, if I had lipo up my neck, my skin would not bounce back. I've got so-so skin at this point. It's like, I need Renuvian. So she got Renuvian as well, which is great. So, a product that both you and I have, use all the time, love, super, super effective.
Nice.
Yeah. So I think one of the things I've been seeing more and more on social media is more things about deep neck contouring. Is this on your algorithm as well, or am I alone on this one?
I personally don't perform it, but if we're thinking a patient, has issues deep with what's glands or other things that need to be addressed, then I would refer them to one of my partners, because I don't personally enjoy doing those types of things. You're welcome to take this one since you love to do the facelifts.
Yeah, but I'm seeing more and more things either on TikTok or on Instagram where people are talking about wanting to have a like snatched jawline, right? Are you going to get there with just liposuction, or do you need something more significant than that? And I think that there is a misconception with a lot of patients about what the fat in the neck is like, where it is, and what it takes to get it, completely contoured down. Because liposuction and Renuvian, which is a great combination, use it all the time and absolutely love it, only accesses the fat outside of the platysma muscle. So for our guests out there who don't have a working knowledge of head and neck anatomy, the platysma is the muscle that runs down along the neck here, the stringy stuff here, the stuff that is outside the muscle and in contact with the skin. And that's the stuff we can get with liposuction. The triangle of fat that runs underneath of the muscle, the subplatysmal fat that sits on your spit glands and by the digastrics, all the stuff that's deep in there, we cannot touch with liposuction. So I feel like when I see these patients, and if you have a lot of, pinchable fat on the outside, it's like, obviously you're going to get a nice result. But I run into patients all the time who have a genetic larger neck. They're looking for that really crisp jawline. And when you pinch away, you're pinching at this and you're like, I'm not pinching any fat. All the fat is running down deep. And those patients are not good candidates for straight liposuction or Renuvian. They really need deeper fat pad work with that, like a deep contouring of the neck. But I'm seeing more and more of that cropping up. And it's kind of funny that originally when we had like deep plane facelifts, deep work on the neck, and then we change out to more minimally invasive things, you start to see where it's a split between what candidates are actually going to be really good for the minimally invasive version and what candidates are really going to be the candidates for the more maximally invasive approach. But we all push towards the new technology because we're like, oh, new technology, less downtime, people are going to be happier. And then you run into these patients who are, still need the old school method to really get what they are after. But I've been surprised at how many pictures of patients who are like 20, 30 years old, having deep neck contouring for removal of portions of their spit glands, or with removal of fat to dramatically change their jawline because they're looking for that super crisp, and they just do not get it with just liposuction because they have a genetic component to it.
Yeah, you're the expert on that, so I agree with everything you just said.
I don't know. It just seems
I'll
like
send
something.
them to you.
It's just something that I've seen more and more as we're moving forward. And I think when people are talking about snatched jawlines, you hear people talking about, kids. It's like General Alpha kids who are mewing and doing all sorts of stuff to really maximize the jawline. Surgically, that's what's really making that super dramatic change for people like that. It's like, it's not really going to be the liposuction of Renuvian, but for the article in Glamour, it's like she was a good candidate for it. I mean, she had a nice result. It was a nice change for her. But it's certainly true that if she wanted a more defined jawline, it's like that's what she would be moving forward with, is kind of the deeper neck contouring. Yeah. I wonder if we're going to continue to see more of that as people get more and more excited about jawlines. If you can't get it with lipo and you can't get it with jawline filler, that's the next stop.
I mean, it's obviously a hot topic. You read the article in Glamour. I was interviewed actually 2 days ago for an article exactly about submental liposuction, jawline contouring, and neck liposuction. The whole article, and it's in a major magazine. I can't say where it's going to be released, but it was an interview, and they had interviewed me because they're like, well, we know you've talked about having it your own done. Again, a lot of the things in this article are what you've already touched on. So it's definitely a huge topic, like you said. I think it's going to become more and more. Social media is spreading it. So I think it's great that you're talking about that and you're an expert in that. So
yeah. Well, for me, it's like it was something I would consider if I didn't have a beard covering it. I can feel that the skin is looser here, and it's a little bothersome to me when I'm picking at it, but I can't see it because it's hidden, which is, beards are like our version of makeup to hide imperfections, right? It's like I don't use makeup, but I have a beard to cover half my face. Also saves me on skincare.
That's true. I actually can't
half
grow
off
facial hair very well, but when I had my submental lipo, it's the first time I ever grew hair because when I would razor or shave it, it was so hypersensitive from the lipo. I couldn't stand it. I couldn't touch it. So I let my hair grow out. So it's funny because even though I had a more contoured jawline, I was hiding it with my facial hair, like the opposite. But now I feels fine.
It's like you can't have PRP or some sort of laser or something that will magically allow you to grow hair, and we haven't fixed that technology yet.
I guess I've seen beard transplants. Actually, speaking of, did you hear there was a gentleman, I think he was from the UK, but he went to Turkey recently, had a beard facial hair transplant. Okay, so they do the hair, the follicular hair grafting to the front of the scalp. Well, he had it onto his face to fill out his beard. Well, I guess he ended up getting horrible burns on his face, like third-degree burns. And 3 months later, he was so depressed from how badly disfigured he was that he ended up taking his own life.
Oh, my God.
Himself. Yeah. So, I think this brings up a whole area. We're talking about, trying to restore hair, but also, contouring and all these things on the face. Like, these things are not, they're serious things that we deal with. And, I think going somewhere out of country to go do something and again having that type of experience, I mean, I'm sure he did it to save money. I think they talked about it in the article. It was in the Daily Mail that I saw it. But yeah, I mean, that he was completely disfigured and then ended up going home and he was super depressed, unfortunately.
Oh my God, that's so sad.
Yeah, super sad.
And I know that Turkey is basically like the destination for hair restoration in the entire world. It's like so many different countries, people go to Turkey for their hair restorations. I've seen pictures of planes leaving Turkey when there's like 30 guys who all have scabbing and stuff on top of their head because they all get their hair restoration done there. But I've heard that they're also kind of spreading and doing more and more things in Turkey as well. But I saw a couple of articles talking about how some of these companies are targeting people actually within the UK to draw patients from the UK to Turkey to save money. But it's interesting. But just like anything else, even if they run a super high volume of it, you still have to be so careful who you go to. You got to go to the right people.
Totally. Well, I mean, for the UK and, in Europe and stuff, I mean, for them to go to Turkey, that's like me flying down to Florida, I mean, distance wise and time and all that. So that makes sense. But I mean, a lot of people in the US are flying to Turkey because they're like, hey, I can do, 5,000 follicular units for like half the price or less of what I'd get it here. And I get, a limo picking me up. I get a 5-star hotel. I mean, they make it an experience there. I think some things to keep in mind when you're considering that, though, is one, this is not a customized approach. This is a factory style approach, if you look. And so when people are going to Turkey, it's like they literally pretty much put a bowl on your head, draw a line, and then and it's kind of a more old means of extracting the hair follicles, but they're going to go over and just place them in a straight line. So if you see a lot of these, it's just this, like, there's no actual contour to match your natural hairline. So everyone's leaving Turkey with the same, like you said, scabby shaped hairline, and so, I mean, that's fine if people want that. Two, with the methods they use and the amount of units they use, I mean, a lot of them are being lost. I think there are a lot of reasons why they're doing, so many thousands of these hair units is because of the methods they're doing here. Honestly, in talking to people that are experts here, it's just a very different technique than even the U.S. I mean, they're doing it super fast there, but a lot of those follicles are not lasting. The quality of them is not good. here, I think in the US, we have a lot probably better devices. Like, there's certain tools and robots and things that can really help us get the hair units out, but then also techniques of putting them in. So obviously cost in the US is a bigger thing, right? Like we have our overhead so much higher in the US, but I do think quality overall, you can get really good quality here if you go to the right place. So it's always important to do your homework. And maybe if you talk to people who have been there and if they had a good experience or not, but definitely
don't just pay attention to reviews. You gotta vet it all the way out. Well, it's got to be more expensive here if you're using ultra expensive robots to remove the hair follicles and place it back in. It used to be just techs who would come in to help separate everything. Now, we still have techs that help with the whole process, but the extraction and placement, they have robots that can be involved in that, which is so interesting that we put so much time and effort into that. We've got robots that do, colorectal surgery, and then we've got the other robot that's like set for that. And next stop is going to be like the Tesla robot with the hair extraction robot. So there's no tech. It's just all robots just for all your hair needs. And work 24 hours a day. No breaks. They don't need bathroom breaks. Just can you imagine being the Tesla robot? They're like, okay, well, you're one of the hair follicle separation guys. Like, this is what you made me for.
For real?
It's like, can't I get a more interesting job? The separation. Poor Tesla robot. He's going to be stuck with all the horrible jobs. I don't know. I feel the text jobs, when you see all the text, they have these like big magnifying things, tiny tweezers, and they're separating these individual follicular units. Part of me feels like there would be something nice and calm and peaceful about that. But I feel like once you've done that for months, you're like, wow, this is a lot for what we're doing. But it'll all be robotic, apparently.
Thousands in a day, you're doing these. I think it definitely takes a very specific personality and someone with a certain skill set to be able to do that, because you definitely need to be resilient. You need to be, I couldn't do it.
It is so hard. I tried to make a TikTok about this, try to make light of how hard it is to give someone a quote without seeing them, and didn't do awesome. So nobody saw it. It didn't fly. It only like 600 people saw it. But trying to figure out how much something is going to cost without seeing someone is tough. And then even then, from provider to provider, it's always significantly different. And it's so hard for people to compare kind of apples to apples. But I was looking at, in this Glamour article, she said that she received her liposuction and Renuvian in exchange for potential coverage. So she did not pay, but they did give her a quote so she knew what the cost was. And what they had here is they said the procedure cost was $6,500. The facility fee was $1,200 because she had it done under sedation. They charged $750 for anesthesia, and then they charged $500 for the Renuvian for the actual device itself. And that if she had pulled out the Renuvian and just done the lipo, it would have saved her $1,200. And I looked at the pricing for that. The Renuvian handpieces they're running at a loss apparently for how much they're charging for the.
I heard that too. I was like,
I was like, was that wrong? Did they miss a one? Because it's
the handpieces are over $1,000, right? They're like I think 1,500 or something. Right?
It depends on the length, but it's like 1,100, and they would have used the shorter one, so it would have been like $1,100 or something. But apparently they're like, I don't know I don't remember what practice it is, but they got to look into it because apparently they're hemorrhaging.
Maybe double check that.
Hemorrhaging Renuvian money. Definitely lose a few bucks on that Renuvian. They really cut her a nice deal unless you got like a free hand piece or something.
Yeah, maybe Renuvian donated it or something.
Yeah, I don't know, but I saw it. I was like, my eyebrows hit the ceiling, so I was like, that's cheap. That's very cheap for the Renuvian system. She didn't pay it either. Didn't pay it either way, but it does make it difficult. And for you in your practice, your initial contact is a patient care coordinator, right? I'm assuming they have like some sort of discussion with the patient before you're seeing them.
Yeah, for sure. Yeah, because no one's just walking in, there's no cold calls. So there's always, interaction between my patient coordinator ahead of time and figuring out what it is exactly they're thinking they want done. And then that
you don't take walk-ins? It's like a barber shop.
I have a funny story. I actually have a funny story about this really fast. So when I first started my practice in 2020, I was upstairs in this building. There's like 7 other plastic surgeons in the same building, but I had my small practice. There's like 6 of us, and me and my staff. And we're in there, and I'm not even kidding you. 4 women walked in. It was like at lunch break. They were on lunch break. They all worked at a call center, and they walked in and they said, "Hey, we'd love to schedule a breast augmentation consult for all 4 of us. We're all friends, and we're on lunch break right now." I happened to be up there between my cases or whatever, and I was like, "All right, let's get you all in.
Dude, everybody in the same room. Let's go. We got 1 hour. Let's knock this out." Oh my God.
It never has happened ever again. But yeah, they had 4 breast aug walk-ins in one setting.
That's wild. I mean, nobody ever just wanders in. Everybody calls. It takes weeks to months to get in for you years. But it's interesting. It's like get walk-ins like that.
Yeah. So they'll speak to the coordinator and again get the overall kind of gist of what they're wanting or they want done. And then if it's anything with breasts, then we're usually doing sizing and trying to get an idea of what cup volume and things they're maybe wanting. So at that point we have measurements, we have all that stuff done, and then I'll go in with my medical assistant and go through the whole consultation, kind of go head to toe what they're wanting, come up with a plan that's specific for them. And then based off that plan, that's, the coordinators will put together the price quote, like you're saying. That includes the surgical fees, the facility fees, any special equipment fees.
Oh, yeah.
And then, we include things like lymphatic massage, overnight stay at our facility, all the reform and repair, everything is included. So the price, and then anesthesia, like you mentioned, that's all there. It's all itemized. So there's no surprises, but everything's there. And, and it's customized to them. That's what we do. And I don't know if that's the right way or the wrong way. It works for us, but I think every practice is a little different on how they go about that. But I think transparency is the most important thing.
And then, so I guess the big thing for patients is, do you give people ranges of costs of things if people are cold calling or on your website? I feel like that is so difficult because so many patients want that information. And I'm like, that's fair. Like if I'm going to a car dealership, I want to know how much the car may be. Right? That makes sense.
Yeah.
I'm not going
15,000 or 500,000. Like what's this car?
If this car's $1 million, I'm not coming. So I just, it's like, I can understand that they want to know, but it is so hard to give someone even just a reasonably small range without laying eyes on them and knowing what their history and what their goals are. But I feel like you get so many calls about this. It's just difficult to make people happy with that question and, kind of to be able to bring them in to discuss.
Totally. I think on some level, there's certain things where you can say, okay, if it's a standard breast augmentation, it's pretty much this price, If it's with a lift, maybe it's this price. But you start throwing in, like you said, things like tummy tucks, liposuction areas, skin tightening areas, ovally for cellulite treatment, it gets out of control. And so your range goes from 12,000 to 50,000. And then they're like, well, that doesn't help me. It's like, well, I don't know until I see you. Right. And I think that you bring up that good point is at the end of the day, as physicians and providers, like we want to come up with a safe plan for our patients, but that has to be done in consultation, whether that's virtually or in person. And it really has to be customized to you because there's just no fixed price. This is not like going into the grocery store and even beef is not the same because it's per pound. So you buy a thing, it might be 2.3 pounds. It's gonna be different than the price of,
well, it depends on the quality too. Is it grass fed?
Yeah, exactly.
Is it like, was it the level 4, level 5 where they get to go outside and like run around and have friends and stuff? I mean, the prices for that are even
social cows.
Yes. But yeah, it's difficult, and I want to be helpful, right? You want to feel helpful. You want to feel like patients like getting helpful information to them, and you want them to feel comfortable and confident to come in to see you. But I feel like the nightmare scenario is that someone calls in, they're like, "Hey, I want neck lipo." You're like, "Okay, I don't know anything about you," and you're just, you're asking my front desk staff for a neck liposuction quote. It's like, okay. It'll be, if you're going to do it in the office and it's going to be quick and we're just doing lipos, like this is the price. And then you see that patient and they're like, okay, this is how much this is going to cost me. And now I'm coming to see this person. And then it turns out that they don't really have fat. It's a bunch of extra skin because they're 65 and they desperately need like a full blown facelift. And we've gone from something that takes an hour during your lunch break in the office to like a 5-hour extravaganza in the operating room. And the price is now 20 times what it was. I feel like if that was me as a patient, I would feel so annoyed that someone brought me in at a price point and you're like, oh, you hit me with the old bait and switch, bring me in at the low price point. It's like, I just didn't have the information to know what you really needed because I haven't seen you, we haven't met. But if you never have them feel comfortable enough to come in and see you, you never even get that opportunity to talk to them about what they really need.
Yeah.
It's tough. I haven't figured it out yet. I'm hoping somebody figures it out and they let me know.
Well, I think it needs to be AI. Like, I think, at some point it's like you text into the office and you've programmed your AI to know pretty much your algorithms and protocols. And I think it really could become more of an automated thing where you get a range for a person with disclaimers. And maybe they are sending in photos and, it's just done all in the background.
Yeah. And I feel like if somebody sends in photos or they send in videos, I feel like that's fine. And we do that from time to time for people who are, they're 5 hours away. They're not coming in for, a hour-long consult. So we have them send in photos and you can get a pretty good idea, although you never really truly know until you get hands on someone and see how their skin moves and see what they really are going to need. But at least gives you a general idea. That will be our Tesla bot, will be looking at photographs and telling them what they need based on our algorithm for surgery.
Yep. Love it.
Yeah, I just feel like that's tough. But so you give people quotes, but it's mostly kind of ranges and general ideas. When people call in, you don't give them, hard and fast numbers before seeing them in person.
Yeah, I mean, because I get a lot of Instagram messages about it too, directly to me, not just to my office. I mean, our office has been trained and they have lists of, again, ranges, but for me, I just say, hey, look, for breast augmentation, it's this range, but I can't give you an exact price until you're seen in person. I think that, like you said, it's building that relationship with the patient. And if they feel like they're being bait and switched from the beginning, like you've already ruined that trust with that patient. So I think it's super important to just, be full disclosure. Like, hey, I don't know. Like, and this is not like I'm not trying to avoid the question. I just truly don't want to mislead you or, to give you a wrong answer because I don't know yet.
Yeah. The DM thing is interesting, their version of cold calling to us, but that's what I was talking about on my TikTok.
I saw that was a funny TikTok. Yeah.
How much do you charge for a lipo? Yeah. And I feel like that is the most common one. And I think it's these procedures that have a lower price point in general that people are more apt to, this is their kind of first foray into plastic surgery, that they're calling around to see who is charging the least, although I don't think that that is necessarily the best way to pick your provider.
Yeah, no, I agree.
The bargain basement neck lipo. I don't want to go there. Tougher to touch up. You probably spend as much time on social media as I do. I don't know. I'm probably several hours a day.
Spend 40 hours a week on it.
Several hours a day. It's just like where I currently am. Yeah, it is a secondary full-time job. So what non-medical content creator do you follow that has like, they do something or are interested in something that you really do not have interest in? And why do you follow them? And it's like, what out of what they do kind of draws your attention? Or are you just like,
I follow someone that I'm not interested in? I don't follow anybody I'm not interested in.
Here, let me rephrase it. So what non-medical content creator do you follow whose like main topic is not something that's like near and dear to your heart, right? So say like I follow skiing vibes because I love skiing, right? Do you follow any content creators who their main focus is following something that isn't necessarily one of your exciting, something you're super duper excited about, but the way in which they produce their content, you find fascinating, interesting, exciting, engaging? Because I have a couple of those that they are content creators that are like very specific to a world that I'm not connected with, but I follow them because I find them so incredibly entertaining. And I can give you my example if you want to think it over.
Okay.
Or I have a couple of examples. So one of the content creators I follow is too buff for this. Now, you can tell by my physique that I do not lift weights. I haven't lifted weights since I was like in college, right? I have no muscle. But basically, for a lot of his videos, basically he's looking at people who are lifting weights. You know, it's other people lifting incredible amounts of weight. And his content is basically just him filming himself. But the reactions that he has, how everything is laid out, his like cut-ins and editing for like things he takes from TV or movies or anime or whatever. He does such a good job of how the whole thing is laid out that even though I could not care less about someone lifting 900 pounds, right? It's like, I could probably lift 200. I don't know. I'm not sure. But so I don't lift, I don't know. But what he's looking at has no interest to me whatsoever. And yet I am fascinated. Anytime he puts out a new video, and it's basically every single day, I watch it from start to finish. Just the entire thing, just because he does such a good job of staying interesting and engaging, even though it's within a topic that is just not for me. And I didn't think that would ever be a thing for me. It's like, I'm not going to watch somebody who's like making boats in a bottle or something, but maybe I would if they were just that entertaining. But the content just is so engaging and so interesting to me that despite it being a topic that I do not care about in any way, I'm 100% on board. I'll just keep following him. Love it.
Yeah, that's interesting. Like I said, I don't typically follow accounts that unless I like the topic, but because there's just so much on there now. But there is one account, I can't remember the name of it, but I love the style of filmography and the quality of the videos and actually the post-production editing they do to create these reels. And what it is essentially, they will take any object, let's say it's a matchstick, and you'll see it. It's almost like they use a macro lens, just this super high resolution, macro lens, and they'll be zoomed in really close on a matchstick, and they'll go through the whole process of the match lighting, and then they zoom into the tip of the match, for example, see the flame, and it keeps zooming in down to like a chemical level. So there's like this aspect of Adobe After Effects and doing things to like blend it all together. But it's super fascinating to me because they'll take all these, like they'll take like a nail and they'll show a nail being hammered in, but then they show on like this, like almost like a molecular level, what's happening in real time. And it's just so fascinating to me because it puts, I think, the world in a different perspective, right? It's like we're literally getting down to like the molecules of what's happening in the world around us. We're not really thinking about that on a day-to-day basis, but it just is more thought-provoking to me. And then I think, again, it's just more the quality of how they're able to create these videos. It just shows the attention to detail. So for me, I don't remember the count, but I love seeing those videos, and I just sit and watch that forever. I just go through every single one of them, and it's fascinating.
Yeah, I find it interesting with these algorithm checks, right? It's like the algorithm knows what you dig based on how much time you're spending, what you're liking, what you're sharing. And then it comes up with ideas based on that. You're like, well, if you like these three things, you may also like this based on these other people who also like this thing. And sometimes you're like, nah, get out of here. This is dumb. I don't like that. Please, no more of that. But every once in a while it hits. And sometimes it's something that you didn't know that you would even like, but then you're there. You're 100% all in. The algorithm was right. If somebody asked me about it, I would be like, no, that's not something I'm interested in. But it gives it a shot. And you're like, you know what? You were right. Nice job. Nice job, Instagram.
You got me. I think they know us better than ourselves. So it reminds me of Spotify. So every day, in the OR, I'll play my Spotify, and have you ever done this? It's called the day list. So the day list builds a playlist for you, and it cycles every like 4 hours, I think. So it's always updating. It's always a new day list. So every 4 hours it changes. And
this is different than the daily mixes. This is like
thing? This is like custom to you. So right now, this is my day list. Okay, and the title of the day list changes because again, it's an algorithm like based off of what you listen to at certain times of the day. It creates. So for example, I'm going to read to you what this is, and it's funny to read what it thinks you want to listen to. So this is called Southern Hip Hop Trill Wednesday Night. Okay, that's the name of my playlist. It says you've listened to hip hop and pop on Wednesdays at night. Here's some Southern hip hop, trill, socially conscious, bougie, lyricism, and conscious hip hop. So it comes up with all these like hashtags, you know, these like categories of music, and it blends them together to create this playlist. And sometimes it's just so funny. Like it's like because you listen to US wrestling music and, you know, badminton tunes, we're gonna play this reggae tune. And you're like, well, this makes no sense, but it kind of, like you said, it kind of works, and I'm happy with it.
Yeah. I feel like as surgeons, I'm sure there's other jobs out here that people are so protective of their Spotify lists. And I feel like most of us use Spotify. I used Pandora for a while, but changed over to Spotify. But we are so protective that if someone is using my Spotify for something, they want to listen to something in the car, I get like anxiety, because what's going to end up happening is we're listening to whatever you want to listen to in my car. Yeah. But then when I'm operating tomorrow, it's going to be like, oh, you love Taylor Swift now. So now Taylor Swift is incoming and you're going to get a heavy dosage while you're doing this breast augmentation. I'm like, this is screwing up the whole vibe of this operating room. Not that I have something against Taylor Swift, but she's not like my favorite artist. But you're so used to listening to songs that are within kind of a realm that you're comfortable with, that when someone messes up with that, messes that up, it really affects how the operating room feels and flows.
Totally. We did yesterday a booty mix. So like I was doing a BBL, Brazilian butt lift, and I'd never played it before, but the scrub text like, hey, let's do the booty mix. I'm like, what is that? It's on Spotify. So we listened to it, and it is like the perfect beat. Like the beats are fast enough, so if you're doing liposuction, you can go to the pace of the music.
It's perfect.
And actually, it's all like upbeat. We were laughing. I had no idea that was a thing. So next time you're doing a Brazilian butt lift, just listen to the booty mix.
It's booty mix, yeah.
Yeah.
I've actually worked with surgeons who listen to EDM, like high pace EDM, when they're doing liposuction like, cases to get it going.
You really do go at the pace of the beat of the music. You kind of subconsciously start doing it if you look.
Yeah.
For sure.
Yeah. No, it's interesting how protective we are to those mixes and how important it is. I feel like in residency, you don't usually have control. You have some control over the music because you're usually the one who's turning it on, but you're turning on the music to whatever the attending is going to like to make sure that they're in the best possible mood for the case, or at least that was for me. You're like, I don't know, that's not what I did, but that's what I did in residency. I made sure the music was, try to have it be appropriate for whoever I was operating with, but I wasn't prepared for what the weight of picking the music for the entire room for the day was going to feel like, because you can feel some amount of judgment with some of the playlists that you listen to. Because I have some of my playlists will tend towards like 2000s, like heavy rock, where I have like Linkin Park and Zebrahead, and sometimes the circulating nurses are less excited about that level of energy for music than I am. So you can tell that they are, they're moving away from the speaker, or they're turning it down clandestinely so they don't have to listen to it quite as loud, or moving it on to the next one, which means you feel self-conscious that you're like, not playing music that everybody likes. Like, okay, well, when I'm with that nurse, I have to listen to something that's a little bit more chill so they're not mad about it. It's another layer of things you feel like you have to worry about. Or maybe that's just me. Maybe I just have generalized anxiety.
No, I totally hear what you're saying. What I started to do is we just go around the room, and sometimes we'll just say, okay, I'm going to pick a song, and then everyone just picks a song, and we just keep rotating songs, And so everybody gets to pick, and so they don't feel like they have to pick something that I'm going to like to listen to, because the next song is going to be different anyway. So we'll just go around the room, and a lot of time, our circulating nurse will change it, or we just say, hey, Siri, or hey, Alexa, whatever, change to this song. So no one has to actually physically stop their job, but we can be doing what we're doing. So we do that a lot of times. It's kind of fun. You maybe should try that and, get anesthesia, see what they want to listen to. It might be some kind of like, bohemian, music. I have no idea. Just get random stuff.
Yeah. I usually use the daily mixes on Spotify. So they have like the 6 daily mixes, and I'll pick, because they're usually like 3 hours. So that hits most of the mid-sized cases, top surgery, breast reduction. It's like 1 daily mix worth. So based on the room and kind of how I'm feeling at that time, I'll usually pick one of those. That's typically how I get it done. But maybe it's time to change it up. Maybe it's time to do something different. Go round robin on the music.
Yeah. Try it. See what you think.
Let go of the reins. But then other people will notice that that's a position of power, but it's also a position that requires respect and making sure that everyone's happy.
Yes, indeed.
Keeps the vibes going.
Give me some feedback. See what you think. When I was closing, I used to always play Korean pop music, K-pop. because again, the beats are super fast. I have no idea what they're saying. So like, I am not singing along. I'm just like, it sounds good, you know, but I'm like quickly closing, you know, I find like I sew a lot quicker and all that. So we used to do like K-pop. When K-pop started, we knew the case was winding down.
It's like the second you ask for a stitch, the nurses change over to your closing music.
Oh, they knew.
It's not Closing Time by Semisonic, which I feel like is the...
I heard that. I actually listened to that song
anthem.
yesterday. I hadn't heard it in forever.
Yeah, that's definitely my 90s alternative daily mix section. I feel like being someone who's 43, that's a common time frame that I go back to that music. So Semisonic's on there. But I actually get a little irritated if it shows up super early in the case. It's like third song, like, okay, change it. We need to come back to this.
Yeah, we're like, yo, we still got 6 hours now. They're mocking me now.
I am just starting.
Some
Give me a moment.
Cherry, you know, Eagle-Eyed Cherry. What's that one song? Save Tonight? Or what's it? Is that what it? Yeah.
Yeah, it's for that one.